depression is 100% curable. The best indicators is biological functions.
And today we have got Dr. Hashmi with me. He is the psychiatrist working in most of the UK's biggest hospital for quite some time. He's got vast experience in dealing with mental health problems, depression, anxiety, ADHD. The good thing about him is he has written lots of books. Two are already published, and he is working on them. The meeting today was that we have got an informal chat with him for the person, layman, people to understand about depression, to look at what are the red flags in depression, and how to decrease the risk of self-harm, suicide, and to help our friends and relatives and the people around us to deal with depression on day-to-day basis. So it's not only a disease. It's a condition which affects not yourself, but your friends around you, your family around you, your work colleagues. Dr. Hashmi has kindly spared his very valuable time and very expensive time for the public service message to help everyone, young people, old people, everyone to deal with depression.
Thank you very much, Dr. Mirza and Diane. It's my pleasure to be here today. Now, regarding depression, the first thing everybody needs to understand is 100% treatable. It's 100% treatable. Yeah. Number two, yes. Number two, it actually, the indicator of depression, the best indicators is biological functions, sleep and appetite. If you are sleeping well and there has been no change in your sleep can go either way. People can lose their sleep or people can oversleep in depression. Yeah. So if sleep is okay and your appetite has no change, there has been no change in your appetite, you are not depressed. Yeah. It's a very, very simple thing. The third thing is now depression can be misunderstood in physical health conditions. Vitamin D deficiency, hypothyroidism, anemia are just very basic common examples. Yeah.
A layman, if you are having symptoms of depression, you must see your GP and get your blood test checked as well.
That is the message. A lot of times we get a prescription of antidepressant without having physical health checks. So the first thing is depression is 100% curable. Number two, if your sleep, there has been no change in your sleep and appetite, you are not depressed. These are the basic biological functions. Even mood is affected afterwards. Your energy level is affected afterwards. The first thing which actually affects is your sleep and appetite.
Okay.
Yeah.
I understand. So if you've got now depression, you have done the test and your tests come back normal, and you have mood and which can be circumstantial.
Yes.
So how to deal with it and how
yes. Now you need to look at three things. The first thing is there a reason for depression? Number two, is there a family history of depression? Or number three, is it something other than depression?
Okay, that's interesting. What is other than depression means?
Now, in the last 5 years, even before COVID and lockdowns, I have come across so many people who have been prescribed antidepressants and misdiagnosed with anxiety and depression when basically the issue was neurodiversity, autism, ADHD.
Oh, that's
now lockdown has brought this onto the surface because the young people, a lot of people at home, they realized that there is more to their depression. They had the chance to think.
Okay.
Before then, we never had thinking time.
As a layman, Diane wants to know what is neurodiversity means.
Neurodiversity means that you are a very intelligent individual with extraordinary qualities and a huge visual learning, but you feel misfit. You
Okay.
feel misfit socially. So, in
Mm.
simple words, you don't feel like gelled into the system because you see world slightly differently. You are more focused, more academic. Like in autism, it is classed as so, socio communication disorder, social and communication disorder. I don't think it is a disorder, is the right word with it. It is actually you have uh, uh, lifestyle priorities, certain things you like to do, certain things you like to do in certain manner, and you
So,
may have some sensitivities.
so I'll stop you here. So, in this ADHD or attention deficit disorder, is it the part of neurodiversity then?
It is ADHD and autism is a part of neurodiversity.
Okay. So coming back to depression, then we'll
Yeah,
do a separate session on
yeah,
autism ADHD. So coming back to
exactly.
depression. So tell us a bit more about how do we deal with it as an individual, what we have to tell our colleagues and
Yeah,
family to help us, and how a person like Diane or his friends can
yeah.
recognize.
If there is a persistent mood swing, persistent level of feeling low, you have started waking up with low mood, and your mood start getting better as the day gets along. That is a diurnal variation. You wake up in rubbish mood, 11 o'clock you start feeling better. That is a sign of depression. Yeah. Now mild to moderate depression gets better without medication.
Sorry, did you say that was depression if they have
That,
a
yes, when they wake up with low mood, they can't really see the day,
yeah.
look forward to the day. But
Mm.
as the day gets along, as the day progresses, their mood start lifting. And by
Oh,
11 o'clock, midday, they start feeling back to normal self. That is called diurnal mood variation.
okay.
That is a sign of depression. Now, you have got sleep disturbance, change in sleep pattern, you have appetite disturbance, you have diurnal mood variation. The next thing is lack of interest. You start losing interest in things which you have always liked to do. Yeah.
Mm.
And then the physical somatic symptoms kicks in, like lethargy, tiredness, lack of motivation, all these things. Now, a
Mm.
lot of times you don't realize yourself. People around you realize that you have changed. So
Yeah.
initially, you will never realize it. Now, mild to moderate depression usually responds better to psychological therapies. Yeah.
So is there
Sometimes, yeah,
any self-help psychological therapy?
exactly.
What are they, and how will you tell a layperson that they can use that before they see a specialist or a professional?
Means self-help is very simple. If you focus on the priorities of life, yeah, improve your diet, improve exercise, yeah, divert your attention from stress factors to something more interesting, you will get better. Change of environment get better. If you find out what is the reason which is causing you botheration. A
So
lot
in
of
my
young, yeah,
GP practice, I normally see the one of the commonest reason is a loss of something, like
yes,
loss of job, loss of partners, a breakup in relationship, and how to deal with that, because they can be very sort of very bad initially, and people do some stuff like self-harm or maybe commit suicide as a reaction to that. So how to avoid that?
now you cannot avoid a reaction to a life event, and there is no medication to it. Depression is caused by a loss. Loss is related to depression. Threat is related to anxiety, which is another subject to talk about. But you cannot avoid the normal psychological reaction to life events. Just don't multiply it.
And how we will not multiply it?
Now then, be realistic. The thing is, talking to someone you have a confiding relationship with, if you're close to your parent, a lot of young people are close to their parents, talk to them. Yeah, they can talk to a great friend whom they know for some years and they have quite a good relationship. The difference among girls and boys is that girls do tend to talk more than boys.
So the message for the people out there, that if they have got a relationship breakdown or they're feeling
Yes,
very low,
talk.
and it's talk to someone, please.
Talk to someone. It's, don't suffer in isolation. Talk to someone.
But my
You
question
will.
would be then, because you said that girls talk more than boys. Would you say that that's more beneficial and guys should talk more?
Yes,
Or
that's
okay.
true. Men actually try to save their pride in
Mm,
most cases. Like, for
mm,
example, I was interviewing one of the gentleman's patients, my patient's wife, about the way she sees the domestic environment, and the gentleman had depression. Now, she said to me a very interesting thing. She said to me, Dr. Hashmi, men don't talk. We
mm,
women, we meet up, we talk about everything. We can criticize our husbands for 10 minutes.
yeah.
We feel better, we go back, and we get on with life. You men, you talk about football, mobile phone, cars. You don't talk about what bothers you.
Right. So the one take-home message, which will I take simply from this talk today, is that please, boys and
Talk.
girls, ladies and gentlemen, if you're feeling depressed or low in mood, please talk. Talk to
Yes.
someone you
Yes.
rely on. If you have got any friends, families,
Yes.
please talk. If you
Yes.
have got no one, then you have lots of help groups where you
Yeah.
can tap in, like your GP and well-being services, IAP services.
Yeah.
You know, there are lots out there. Please
Yeah.
talk.
You
Do
know,
not
the
put in
thing was,
silence.
exactly, the most important thing is there is no harm in expressing your emotions.
Yes.
If you are angry, express your anger. If you feel like shouting, shout. Means within reason, within reason. I
Yes.
mean, the thing which people can't deal with is a constant nature. You can't be angry 24 hours 7. Yeah.
Right. So
But
this is
anger is healthy.
yes.
But I would just off your point before,
Mhm.
I want to make it in the context of young people now,
Yeah.
where I don't know if you've seen this, but there's different figures online which promote this masculinity and not telling people about your feelings and things like that. How would you convey the message to young people like that, especially which are caught in that, to actually express their feelings and stuff? Because there's a lot of people which are saying, in order to be a man, be strong, don't tell people your emotions, make money, do this, do that. But then you're saying that actually is harming them. So what would you say to combat that?
Don't trust these slogans.
Yeah,
If you are a human being,
yeah,
you have emotions
mm,
and you got to express them.
mm,
Yeah.
yeah,
Expressing emotions, sharing them
yeah,
makes you feel better. That is the most simplest. You are the expert of your own self. Know
mm,
yourself better and you will do
yeah,
better. But you don't need to know yourself too much, because if you know yourself too much, your progress will decline. You
mm,
get trapped into your own mind.
yeah,
So we live in houses which has attics. I always talk about the attics. You don't need a perfect clean attic to run a good household, functional household. You go in attic, you are going to scratch yourself. You are going to cut yourself, scratch, graze, nail will stuck somewhere in your foot or your head, it will going to
Mm.
happen. You will come out full of dust and dirt, and you will
Mm.
need a good bath, which might take an hour to get you
Mm.
sorted. Yeah.
Sure.
Do we really need to go through ethics? When people, young people, jump on saying, I have issues from my childhood, it got to be addressed, and they go
Mm.
to psychologist, rush towards them, and then eventually they get over psychologized. That
Sure.
means they end in knowing themselves more than they should know. Some blindness is important. Yeah. And then they get trapped in their mind. Know yourself, only three things. I recommend three things you need to know about yourself,
Mm.
and you will be successful.
Okay.
What you like, what you dislike,
Mm.
what your future goals, wishes are.
Yeah.
If you
I,
know your likes, three likes. This is I like. This I don't like. I won't do that. Yeah. And
mm.
these are the wishes I want to come true. These three things are enough to keep you happy. You don't need to know a lot about yourself.
So the conclusion for this brief talk is that we should talk to anyone and everyone. If you got in trouble, please talk, and don't overthink. Don't go into your attic. That is overthinking. Don't think you don't need to be perfect to
Mm,
be successful in this world,
exactly.
and you can run your world very good, even if you haven't got all the to be perfect. So, Dr. Hashmi, we will thank you here, and we will ask people to ask questions. We will drop your email address, your online address as well, and we will put some suggestion and people and let them know about your books as well, so they can read.
Yeah. One of these is psychorupsy, which I say that we know, everybody knows about bankruptcy. They need to know about psychorupsy, how to manage their psychological resources. And the other one I have written for little children, that is Me and My Tics in the context of autism. But my few other books are going to be published very soon. One book which will be published by end of this year is called Didums, that is Destructive and Impulsive Decision Makers. And I have included topics like suicide and murder in it as well, and given the methods how to actually make a good decision.
So it means that we have to meet up again sometime, if you don't
Yes,
mind.
please. I think
We
if you
discuss
are,
one by
if
one.
your viewers are happy, I am happy to meet up with you regularly to talk about mental health, because we have a huge area to cover. And if anybody is getting benefit out of our conversation, I would love to be here. Thank you very much.
Definitely. Thank you very much. Thank
Thank
you.
you very
Thank
much.
you. Thank